have there been any, specific to this sort of situation? Obviously you mentioned a couple in terms of, getting patients the examinations that they need. Have you come up with any ways to sort of creatively bypass or, creatively conduct those exams that, are so essential to the care you provide?
So there are a couple of key examination pieces for headache medicine, which are just irreducible. They can't be done by a family member, and they really need to be done by somebody who has, the real skill in doing this. And one of those is a really thorough examination of the eyes, particularly to look at the retina to see whether or not there's evidence of raised intracranial pressure, for example, or be able to look at subtle differences in reflexes, which really need to be elicited by somebody who knows how to perform a neurological examination. So I have not found great workarounds yet about this. I'm certainly always reassured when I see a new patient, new patient questionnaire or referring notes or the like, where they've been seen by an ophthalmologist recently, or they've been seen by somebody who I trust in terms of their examination, where I can feel, well, okay, that will be at least some measure of assurance about this. But I think that's really the huge limitation, that we cannot examine our patients adequately, and patients need to be accepting, because we all have to accept that this is a limitation right now. Hopefully, several months from now, when the social distancing precautions are lifted, we'll be able to make up for that in an important and quick way. But right now, we're all living with it. So I'm not really sure that I've found a solution yet about that.
Yeah.
With respect to certain types of procedures that are really now mainstream or mainstays for treatment of chronic migraines, such as Botox, which is performed every 12 weeks or so, or occipital nerve blocks, or certain other types of blocks that people receive on a recurrent basis, those are just not available in most medical centers. Certainly our medical center, it's very, very clear that they're considered elective, non-essential visits, and as a consequence, they've been excluded from care. And as a result, we really need to find ways to provide substitutions which are as effective. Not always the case, but the good news is that, since 2 years ago, May of 2018, we now have several outpatient medications which are approved for chronic migraine. These are these new CGRP antagonists and CGRP receptor antagonist medications that can be given as subcutaneous injections on an every 3-month basis by people at home. They're very easy to learn how to do. They're easy to instruct people even remotely by telemedicine. And we've been really working hard to try to transition patients who are on Botox therapy and maintained and are doing well on this quickly over to these new medications. And this is where one of the most important kind of urgencies lies, which is that we need to ensure that the private payer carriers and that CMS, which would really help provide really the policy guidance for Medicare and Medicaid beneficiaries, are on board with allowing people to transition quickly without there being burdensome regulatory issues, extra paperwork, or in the case of some of these medications, fail first policies where people are expected to have multiple months of trials of medications which are either unproven or are simply off-label and show really negative evidence that they help. So we really need to reduce some of these administrative barriers to make sure that these patients can get the therapies which will really keep them from needing to even worry about whether or not they should come into emergency departments when we know that they really should be staying home. So I think that part of this was really, the impetus for this was really to try to appeal to both the governmental as well as the private insurance payers to lower their barriers and to make it easier for people in this time of crisis to be able to get the care that would really make a difference for them.